Mr. Speaker, around the world there is consensus that we're moving into the endemic phase of COVID-19. Unfortunately, federal employees continue to be left behind. In Canada, federal mandates persist and many employees are losing their jobs because of their personal choice. This would include approximately 1,000 members of the Canadian Armed Forces, who now we know can't find housing, at a time when recruitment and retention is already at an alarming low rate. On which date is this government going to give Canadians a federal plan to lift these mandates?
The Honourable President of the Treasury Board.
Mr. Speaker, thank you to the Honourable colleague for his question. You know, having a vaccine workforce makes our workforce and our communities safer. We asked employees of the Federal Public Service to attest to their vaccination status, and they stepped up. 99% of public service have attested to being fully vaccinated. We are currently reviewing this policy, and we will be back to Parliament to share our decision. Thank you, Mr. Speaker.
Hear, hear. Order. It's hard to hear the answers. The Honourable Member for Cumberland-Colchester.
Mr. Speaker, in Health Committee, Dr. Isaac Bogosh stated this complicated science that the Minister of Health keeps referring to with respect to mandates could be summarized in one page. We've also heard again that there's going to be a regular review of these mandates. Where is it? When is the Prime Minister going to be transparent and make us all aware of the scientific benchmarks and government reviews and release Canadians from those who disagreed with him from these vindictive and overly punitive mandates, Mr. Speaker?
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker, and I thank my honourable colleague for his collaboration on the Health Committee, and I'd also like to acknowledge that he served many years not just in the Canadian Armed Forces, but also as a family doctor. And he knows that today we know more about COVID-19 than ever before, and we're in a very, very different place than we were 2 years ago. We have a safe, effective vaccines, a highly vaccinated population. We also have new treatments that can help patients from getting seriously ill. Our government will keep making decisions as we have been over the past couple of weeks, and it would be nice if they could acknowledge that things have been changing over those last couple of weeks. We'll continue to adjust our advice and public health measures based on the evolution of this virus. Thank you, Mr. Speaker.
The Honourable Member for Sarnia-Lambton.
Well, Mr. Speaker, we are in a different place, but there's nearly 4 million Canadians that are having their charter rights violated still. They can't leave or enter the country, and they can't even travel domestically, even though all the provinces have lifted their vaccine mandates. They're being prevented from visiting relatives who are in some cases dying. And so will the Transport Minister admit that vaccinated and unvaccinated people can both get and transmit COVID, and there is no longer any justification for violating the charter rights of Canadians?
The Honourable Minister of Transport.
Speaker, the last 2 years have been very difficult on Canadians. We've had lockdowns, we've had public health measures, people lost their jobs because of the uncertainty of the pandemic. Governments around the world, provincial governments, municipal government, we're all grappling with doing the right things to protect the health and safety of Canadians. Many decisions included vaccination mandate, included other public health measures. We are seeing that our government and other governments are slowly adjusting these measures. We will continue to consult our experts as we review those decisions, Mr. Speaker.
The Honourable Member for Thornhill.
2 years in, and testing for incoming international travelers is creating significant bottlenecks at Canadian airports. Many Canadians still can't travel, and public servants who can be working from home, clearing this government's backlog on just about every single service they offer, they've been cast aside. This ideological crusade of this government is having an impact on our reputation. When will they admit that they've got it wrong and lift the ineffective and now obviously vindictive federal mandates?
The Honourable Minister of Transport.
Speaker, I understand that the Conservative Party does not agree with our government's decision when it comes to public health measures. However, talking down vaccine, talking down public health measures is not a wise thing to bring Canadians along. We can debate the need and the necessity for those measures, but calling them vindictive is unwise, and I call my honourable colleague to realize that we are doing everything we can to protect the health and safety of Canadians. If they disagree with us, they can argue that with health experts, Mr. Speaker.